Coming on the patient, and we are getting ready to aspirate the bone marrow.
So initially we're gonna go down with this needle. Now we're hitting the iliac first. We're gonna take a small bite in the bone. We call it a bite, but it's not really a bite. It's really just getting attached to the bone. Okay. And we gave the patient previously a lot of anesthesia. We gave him local numbing of lidocaine with epinephrine. And a key here is to put it under the periosteum of the bone, and then the patient doesn't feel much. So that's why we take our time in injecting a little bit harder, because you're going to push hard, but it's worth the time, because the patient will feel basically no pain. They're going to feel some pressure, and
as you can see, the incision is very small. It doesn't need a lot of incision to go in.
And now we have this small hammer. So I have it in this glove for sterility. And we're going to tap a little bit here. So the patient's going to feel a little bit of it's more of a weird sensation than pain, because really we are tapping into the bone. And I'm just want to see, now you can see that the needle is really stiff. It's a good bite, and that's what I want. So now I want to check if I'm in the bone marrow. And we didn't show the whole preparation thing here, but we heparinized all our needles to make sure that there's a heparin, because we're dealing with the blood. And we're gonna take aspiration here. This is bone marrow here. So this is a small bone marrow aspiration to tell me that I'm in the right spot. So that's great. That's a test for us. Now we're going to change from this needle, which is a sharp needle, to a blunted needle. And this blunted needle will allow us to go a little bit deeper in the bone marrow. I'm going to lock it, and we're going to tap a little bit more. And you can see the lines here. We're going to go maybe to the second or third line. And we tap slowly here, and you can see it's going down. And the blunted needle will allow us to minimize any potential injury, because the blunted is not gonna, for example, if it hits the other side of the bone, it's not gonna go through it. So it's just gonna naturally correct itself, if you want to think about it this way. So it minimizes the errors of that. And now this is like going smoothly. This is how much I want to go. And right now I'm going to lock this part. And how do you feel, sir?
Good.
Alright, so the patient is comfortable with Cronox, with local anesthesia we gave him. And now this one here, it locks my device. Okay, now I'm going to remove this blunted needle.
And over here we have 1 cc of heparin and a 10 cc. This heparin is just so that bone marrow doesn't clot. So once he aspirates the bone marrow, it's going to mix with it, and it acts as an interference.
And I'm going to put this needle. This is the aspiration needle. And I'm going to put this needle on top. Because, as Delia said, it has heparin. So as we aspirate, now we should have this blood. This is all bone marrow. So for every cc, what we do is we turn it clockwise or anti-clockwise. Yeah. And about 36 or 360 degrees, and aspirate some more.
So why do you do the twisting?
So as we are twisting, the needle is deep in the layer. Suppose this is the layer, we are deeper here. So we aspirate bone marrow, and then we turn 360 degrees, it goes higher. Now every time I'm going higher, I'm aspirating from a new zone. So I'm aspirating newer bone marrow. So every time I turn, I'm aspirating from a different area.
And that's why it goes up.
That's why it goes up. So every time I turn, I'm having a newer zone of bone marrow. And the good thing about this procedure, it's not a bone marrow that I have to spin it around. So this is the only bone marrow that's undone right now. This bone marrow is ready to inject right away. And very good here. And the reason for that is the needle we are using is a newer needle that's even it's blunted. It's perforated from the side, but it blunted from the front. So always it's not gonna aspirate blood from under it, which gives us a purity of the bone marrow. So that's why we call it BMA, bone marrow aspirate. And it's not a bone marrow aspirate concentrate. The concentrate you have to spin it in a special machine, and we don't have to do that. And actually, and it's been beautiful. This new device made a big change in the bone marrow aspiration process. So we're done with the bone marrow aspiration. That was it.
Okay.
How was it?
Good.
All right. So the patient feels comfortable. You can see the incision is very minute. You can see it here. All right. So let's get some. So this I just want to put some steri strips. Okay. And you might give me some alcohol.
Alright, so this is after the bone marrow is aspirated. Next part is going to be the
Alright.
injection of
Okay.
the bone marrow.
Yeah, so we're gonna inject the bone marrow. We'll come back with another video as we are injecting. Today we're doing the rest. All right.